Is a little alcohol or wine okay for our health?
Well, interesting thing is the evidence-based information up to date is saying no. There's really no nutritional benefits of having alcohol, although alcohol has been consumed for centuries and thousands of years. I mean, early form of beverage was an alcoholic beverage in almost every culture, and we use it for celebrations and other things like that. But what the most recent studies are looking at is, and there's still a big push from obviously alcohol lobby groups and the industries, and every celebrity selling their own beverage because it makes a lot of money, but there's really true no nutritional benefit or health benefit for drinking. There used to be the whole kind of wine paradox, or people used to be like, well, let's have a little bit of glass of wine maybe for the resveratrol in there, but really when you went to the fine data points of the study, you had to drink like 40 cases of wine to get the benefits of the resveratrol. So everybody wants to have some kind of benefit because that's how you sell a product. But what I always tell my patients is that we're trying to limit the amount of alcohol consumption in general. Doesn't mean that we can't have something for a celebration or a birthday or holiday or something like that. But what the problem is, with where we've seen in the standard American diet and lifestyle is that there's a slippery slope. When we said, drink in moderation, that's what the bottom of every commercial is. But we see the highest amount of, one of the causes of health conditions related to not just the diet, but is alcohol related events. We talk about drunk driving, we talk about, other cardiovascular and pancreatitis and liver problems. And so it's not that I'm anti-alcohol, but what happens with my patients is as we get healthier over time, is that we just tend to not want to consume alcohol, right? Because it's kind of like the cleaner your machine. Like once you become, once you go from a Ford to a Ferrari, you don't really seem to, you want to keep running the machine and then running like a fine-tuned engine. So that's my perception, but I'm not, dictatorial. But what I also want to look at is when patients do drink alcohol, there's a limitation, when we're talking about drinking, 1.5 ounces of hard alcohol, 5 ounces for wine and 12 ounces for beer. But the average person actually consumes more than that. So we know they have beers or pitchers of beer or glasses of wine. Same thing with even when we talk about soda. Someone say a glass is, I have a soda a day, and some people can have a big gulp, which is 64 ounces, still considering one, right? So, when the study came out on wine, like all of it's like 2 years ago, Napa Valley wines all containing glyphosate. Right. So we're looking at other toxins, not just the alcohol, but, it's grapes. Well, grapes are one of the heavily sprayed foods. So sprayed with glyphosate, which is herbicide, pesticide by Monsanto, or now it's generic. So these are things that we are now contributing to more gluten problems, more gut problems, and more allergy problems. So looking, I tell people, if you are drinking alcohol, try to get organic, try to get a cleaner form. Don't buy cheap alcohol. Don't buy $2 alcohol. That could probably run your car. So I always look at, try to make it better, at least cleaner, but cleaner doesn't mean healthier, just means it's cleaner. So I don't want to be like, that's an excuse, like I'm drinking the finest tequila all day long and that's still good for me. No, it's better than probably cheap tequila because at least you're getting something real. However, in my overall recommendation is trying to limit to minimal to none and only for special occasions.
Which of these alternative treatments get the best results and which haven't gotten you the results you wanted? Homeopathy, acupuncture, herbal medicine, Ayurvedic medicine, physiological regulating medicine, plant-based diets, chiropractic care, fasting, and other non-traditional treatments?
Well, that's an interesting question because we get good results with all of them, but it's really the approach and the experience of the practitioner and their knowledge, right? So can we say there's a lot of failures in a lot of those things? Yes, just like conventional medicine. It all depends on who's driving the car, right? So you want someone who's very experienced. So being an integrative physician, I am, and with over 22 years now in practice, and with a variety of training all over from Ayurvedic to Chinese medicine, acupuncture to herbal medicine, plant-based diets, and integrative fellowship trained 20 years ago with Dr. Andrew Weil in the program of integrative medicine. That we're looking at now is like true detail of the delivery of the clinician's experience. So plant-based diet's number one. Like you have to do a plant-based diet. That's what the data shows. That's what all the recommendations are. So it's really no more debate. And in fact, when I give the lecture in this conference, by the time I give the lecture at the end of the week, but if you don't understand that you're supposed to be eating plant-based, then you haven't been paying attention for the whole week of all these wonderful speakers that are going to be there. But from my perspective, there is limitations because a lot of times, for example, chiropractic care, I find is not really doing chiropractic in the last 15, 20 years. They're not really doing hands-on hands-on, manipulation. They're really doing what I see in my state is like, it's like, you pay a fee, you go in, you get treatment. And I have patients who are like 5, 7 years, 10 years going to the chiropractor every 2 weeks for back pain. But it's never like, are we healing the back pain? Are we looking at the underlying causes of that? So is it maybe safer or better than getting steroid injections? Sure. Is a patient actually getting better clinically? Temporarily. Are they healing themselves? Not necessarily. And are people just kind of giving fancy machines where they can bill insurance or some subpar supplements? I see that all over the place. When the same thing when it comes to homeopathy, or same thing comes with herbal products, is it has to come from the experience of the clinician and understanding potency, purity, safety, and efficacy of what we deliver. And are we following clinical studies? And are we looking at herbal medicine? Do they have a practice of that? Because everybody on the internet seems to be some kind of expert of everything. So that question I like to say is that in the hands of experienced clinical, integrative physician, we have excellent outcomes because it's understanding how to pick the best of a little bit of all of these and fine tune it, rather than saying like dictatorial, like, well, this is just Ayurvedic medicine, this is Chinese medicine, this is just diet only. And that's where, right now there's lifestyle medicine where there's just plant-based doctors and that's all they do. But then they also then just prescribe conventional medicines. They don't do herbal medicines or natural products, and then there's other people who just do, natural medicines and they don't talk about diet. So when we have this integrative approach, it actually improves the outcome of our patient because we have more to choose from. And we're able to fine tune based on the history and physical and the lab results of the patient, which of those modalities would fit best for them to have a better outcome.
What is the state of American health?
We are an inflammation nation, right? That's the book right there. I've been speaking about this for about 20 years now. I wrote a book called An Inflammation Nation in 2016. I was lucky to be invited to come speak last year at this Real Truth Health Conference. And, just as I left, everything happened, right? COVID happened. And so now the understanding of inflammation is even more important because I think now the average person around the United States and the world has heard this word of inflammation from a different perspective, from a viral insult, from a viral infection that is called a multitude of inflammatory responses in the body. And now we're even not only just acutely, but now we're having 30% of what we call long hauler or COVID syndrome patients, which have neuropathies and brain fog or memory, cognition functions, chronic fatigue functions, joint issues, gut issues, respiratory issues that again are not life-threatening anymore, but they're chronic disabilities. So understanding inflammation is key, and that's important. And so now I think coming back and speaking and kind of bringing the perspective of what do we really need to do now, because when it wasn't a crisis, people were just worried about heart disease and diabetes and cancer, which we all should be worried about, right? The most common 10 common causes of death we should be focused on. However, now when something comes out of left field and then it starts kind of evening out the whole board, young and old, and even now with the variants, we're seeing a whole new slew of a different demographic, which is now under 30. And this morning, I just read a case of a 9-year-old who's in the ICU locally. So there's an issue where we used to think like, okay, maybe heart disease is this age, or maybe Alzheimer's is this age, maybe cancer is this age. I don't have to worry about anything. And now we have to look at, you have to keep your inflammation under control. You need to lower it. You need to have an anti-inflammatory diet, and you need to be proactive at taking things that would keep your inflammation down, like bosmeric, and keeping your immune system up, like vitamin D and glucan 300, which we carry, and there's a variety of other things of how we understand like stress reduction. In my book, I talk about all the 10 steps. These are the epigenetic steps that you need to take that are evidence-based, that shows your diet, lifestyle, environment, and belief system are important. And if you balance those things out, which will keep the inflammation down and keep your immune system strong, keep your microbiome in balance, and we're checking food sensitivities and microbiome and nutritional deficiencies, and eat right and have stress reduction, yoga and meditation, all these things, you have a great resilience to disease. The problem is, the average American is not that, and they're having issues. And so we have to be very careful on that aspect of just not providing the adequate information of how to lower the inflammation. So America's in a really poor state of health, and I think now is the time for people to really start picking up the book and saying, hey, what can I do to prevent myself? Because being vaccinated is great. They should get vaccinated. However, not all the vaccine is 100%, and that doesn't mean that you still may not be an outlier that has still problems after you get vaccinated. So we still want to look at not only just COVID issues, but we want to look at, well, in the midst of looking at getting healthier to lower, say, COVID risk, are they still lowering the risk of heart disease, diabetes, cancer, Alzheimer's disease? So from our perspective, if you do the good foundation of health, then that improves and lowers the risk for all diseases upcoming.